Hi, I'm Dr. Erica Bruner. Today I'm going to start answering the question, what is end-of-life care? And it could be a long answer, but I will talk about the three different kinds of calls that I tend to get in my practice. One is a call from someone who's already made a euthanasia decision and they just need me to come out to their house and actually do the house call for euthanasia. So that's probably the majority of the calls that I get. Another call that I often get is from someone who's not sure whether it's time for euthanasia. And on one end of the spectrum, that might be somebody who's pretty sure, but they still would like a medical opinion, an exam, a chance to talk it over. So I go out to that appointment prepared for the possibility of anything. We might end up doing euthanasia at the end of that appointment, or we might not. Maybe there's some things we can do, treatments, medications to prescribe to help the animal have more comfortable time. And then on the other end of the spectrum of that situation is someone who, has pretty much decided that they probably don't want to do any more interventions. They don't want to take their pet to a vet. It's stressful. They don't want to do tests. They don't want to do big treatments, surgery, chemotherapy, things like that. Maybe they've gotten a diagnosis, or maybe we just sort of suspect what's going on based on what we're seeing. But where I come in is when the person has really decided that they no longer need what happens in a clinic. They no longer need significant treatments or significant diagnostics. Occasionally, depending on the cooperativeness of the pet, I might do some blood work. But I most of the time don't. Most of the time we're working in that area where people know that what they really want is palliative care with very minimal intervention and diagnostics. And sometimes I get called fairly early in that process. I've done consultations for people, a couple of years before they finally decided to make a euthanasia decision. But it's really nice to have somebody that can come out to the home that is familiar with medical issues, that can troubleshoot maybe mobility challenges, getting around inside the house, medications that we can tweak, pain, things like that. Sometimes these calls involve acupuncture, sometimes they don't. And sometimes there's kind of a middle range situation where someone feels like they're likely to make a euthanasia decision sometime in the next few weeks or months, but maybe they're just not sure how to go about doing that. They want to talk about what kinds of situations or conditions would lead them to make a euthanasia decision, and how to make that decision. And sometimes these are people that have never had to euthanize a pet before. Other times euthanizing a pet isn't new, but just the situation, the way things are going with this particular pet is new and different. And sometimes there are people in the household, other family members, that don't necessarily feel the same way all at the same time. And so a consultation there can be helpful to just let everybody talk about how they feel and what's going on, and try to find a way through a decision-making process together. So those are the various things that I do for end-of-life care. If you have questions, get in touch. If you have a question for this series, please let me know. It's info@heartofvermontvet.com.